Hi, welcome back everyone. In our last video we were introducing the whole idea of understanding mental health and what that means to everybody generally, and those people who use mental health services where it's not always easy to achieve good mental health and well-being. And we got towards the end, we were talking actually about, I was saying about my personal experience as a human being, not necessarily as a member of staff, but as a human being, the importance of showing up and being able to arrive at work and be able to do my work well. And I suppose the prejudices and the stigma and the judgments that are around if you're not able to show up and get on with your work, or if you're not feeling good emotionally, that can be difficult to admit if you work in mental health services because of expectations. So Lisa and I have been having more discussions really about that and how important it actually is for those of us who work in services to be able to show up well enough to be able to do the work that we need to do. And we are all human beings, so we can experience many things that affect our mental health and emotional well-being at any given time, depending on what's going on in our lives. So during our conversations we were able to think about why it is so important actually that we are well enough to be able to do our job, and what actually helps us to do that. And for me, what's really important is feeling supported. I mean, good mental and emotional well-being for me is about having strong values that I espouse to, being supported by other people who work around me, so that I can come and do what I need to do. I can do a better job when I feel well enough. And to feel well enough and to feel grounded enough and to feel connected enough to keep doing my work in the best way that I can and to keep showing up in terms of the best version of myself, what I need is to feel supported, to feel that people have my back, and to feel connected to others at work and at home and in my personal life. And it's not always easy to have all of those things all of the time, but when you know that people have your back and they're supporting you and they're there for you, that you have someone to talk to, that can help you to feel a bit more grounded and a bit more emotionally settled, even if things aren't great all the time in your life. What that also means for me as a member of staff is I can give my best to the people who I provide support and care for in the job that I do every day. And that is really important, because and being able to reflect, having a level of self-awareness and being able to reflect on what makes me tick, what keeps me going, what keeps me connected, so that I'm able to do the best that I can do for other people, because my emotional well-being is inevitably going to affect your emotional well-being because of how I behave and how I am when I'm around you, Lisa. And something else that we also had a conversation around was the question that I have often asked you, and often asked many people who have entered into a whole new journey of recovery in their lives. And there's something about what you and I have been talking about, what matters to you. Why is it important actually that I am well enough, that I am supported, so that I can show up for you? What does that mean for you then, Lisa?
Well, I mean, we do have this conversation a lot, but I think just to go back to one thing there in terms of the staff wellbeing sessions that we've been offering staff, where we're encouraging staff to think about what you're saying, reflecting, and also that piece about prioritising your own self-care and compassion to self. And a lot of staff members saying, in fact, you know, it's easy to do this with other people, but for ourselves it's actually quite challenging, even practicing compassion for ourselves. So there's that piece in there, I think, as well, why staff wellbeing is so important and why it should be prioritised. But as you say, I mean, in terms of, if I think back over my experiences, and I ended up in mental health services at the age of 14, so I literally have a lifetime experience of working with or being with professionals. And what stands out to me always, if I think back, is the people who impacted most on me were people who I felt were really listening to me, people who I felt were really seeing what was going on behind because when you end up in mental health system, you can end up being a diagnosis, you can end up being your symptoms, you can end up being a risk assessment. Labels and things simply do come with that, and sometimes I took those on board myself, as that's who I was. But that ability to be with someone, and I think you've spoken about it, that need to fix and that you've got to have all the answers. And if you actually think about it, even just logically, there is no one professional who's got all the answers for me. Which is why the collective, collaborative piece is so important, because it's not that one is more important or less important than the other. It's just that, this whole thing of equality between physical and mental health. The thing is with mental health is that's about people who are distressed, who are traumatized, who have challenges that you can't just go and put a plaster on and it's going to fix it.
Yeah.
It's actually much more complex than that, because that's about who we are as human beings. And in order to help people along their journey of healing and finding ways that life can become meaningful, is very much about being able to be with people and be with the fact that you don't have all the answers for me. However unwell I am, and I had this conversation, in fact, with a psychiatrist, however unwell I was, I still had to go home to deal with all the things that were going on for me. So you promising me that you've got all the answers simply isn't helpful, because...
No, that's it, and that, thanks for bringing that up and pointing that out, Lisa, because I think in terms of the theme of kindness, it's very important. I wanted to be, as in my whole career, I always want to be kind to people. I think it's something that you come into this kind of work with anyway, an innate kindness. And sometimes that kindness can get mixed up. For me, I think what I wanted to do was fix, rescue, make you better, make other people that I was in contact with and who I looked after better and who I was supporting through their journey. I could never fix it, and I think the whole education piece, self-aware piece, and what I learned about recovery and what I learned about human beings by being in relationship with people like yourself, people with lived experience and carers, as well as staff, was that, and the most liberating thing that I ever came to understand was that I can't fix, I can't make people better, and it's actually wrong of me to think that I can. But what I can do really well, and this is where the kindness actually feels real, is that I can be with you in relationship, I can sit with you, I'm freed up from that idea of having to make people better and fix them, and that's better, because I can have a collaborative conversation with you. I can talk to people who have lived experience about what it is they need and want, what matters to other people and what is important, not necessarily what I think is right for people, because in actual fact then we have a relationship where we can talk about what really matters, find a way forward together, and just be in relationship and have no expectation about things being perfect or me having this idea that I can fix you or make you better.
But I think also it depends what stage I was in my journey, because there was a stage when I actually didn't know what I wanted or what I needed, and I didn't know myself, and I was no expert on myself. And I think it's being prepared to see how do you partner with people at that stage, and staff have said to me, and that's about working with where you're at. And we spoke in our last video about resource issues. Waiting lists, that's the reality of things out there, and somehow I think there's something about our HSE values of honesty and openness, of saying, in fact, I can't give you what you need right now, because there's not, we talk about that when we deliver the regional care pathway training. The reality, there's a wheel there on page 27 which says people should have access to this whole lovely array of services. The reality is it's not there, but what can we do? We can be honest about that. We can partner with people. We can help them on that journey. And it's bringing, I think, a lot of people in this work want to help. And it can be very, if I think about working with me all those years, I think I would have also ended up pretty hopeless and feeling, what else can I actually do? Sometimes we need just holding that hope. I'm here today. Somebody believed along the way. Somebody kept the door open. Somebody kept me being able to come in. But we do need to think of a new way of being with people, and that it's not about fixing, but actually helping people realize that they have within them, and supporting them to discover those resources that can actually help them figure out what is important to them. Kindness at the end of the day is what I remember. above all, are people who just saw me, who treated me with dignity, with respect, and if you're bringing that, you're bringing an awful lot.
Yeah, yeah. And in my experience, just to finish off, I think it's important to say that in my experience, the most powerful impact on my career and on the job and the work that I do now is working in partnership and with people with lived experience and carers and other staff from other parts of the system as well, other parts of healthcare. The most powerful thing for me has been being able to work with a range of stakeholders, working together, bringing honesty to the table, being kind and compassionate with everybody, listening and acknowledging the whole variation of perspectives that exist within this healthcare system, whether you're a person receiving services or a person providing services, and working together actually helps us to, in my experience, helps us to achieve what we need to achieve, but acknowledge that we have a lot more work to do, but that we can do it. There's the whole area of co-production, collaborative working together around the table with different people, and advocacy services as well.
Always stronger and better together.
Absolutely.
Challenging, difficult, takes courage, takes vulnerability to show up at a table where we're all coming from different backgrounds, different contexts, different experiences, different views, even sometimes different values.
Absolutely.
But the end product for everybody can really be so much more than if we're working just as individuals in our own way.
Yeah,
so
absolutely.
we feel really passionately about it, we really believe in it, and we would really like to be able to have everybody at the table. So thank you.